Good morning, good evening to you wherever you're tuning in for this latest Reuters Events Supply Chain webinar on the topic of driving speed and accuracy in healthcare fulfillment through automation. We have a fantastic lineup today, and without further ado, I'd like to allow each speaker to introduce themselves, where they fit in the organization, and where they fit in the overall healthcare supply chain. So starting off with Jerry.
Thanks, Nick. Hi, everybody. Jerry Searles. I am with the Global Logistics Optimization team with Cardinal Health Medical Products segment. We are a wholesale distributor that provides medical products to hospital systems, surgery centers, and doctors' offices.
Perfect. Thanks for that, Jerry. And next up, Wanda, if you can introduce yourself, your organization, and where you fit in the healthcare supply chain.
Hi, Nick, and good afternoon and good morning to everyone. I'm Wanda Johnson. I'm supply chain specialist leader for Deloitte Consulting. I fit into that space of helping our clients understand the intersection of people, process, and technology, where we reshape the end-to-end supply chain and solutions from order management to fulfillment.
Perfect. Thanks for joining us, Wanda. And next up, Steve, if you can introduce yourself and where you guys fit in the healthcare supply chain.
Yeah, good day, everybody. I'm Steve Branch. I lead the sales engineering team for Locus Robotics, and I'm pleased to bring an automation provider's perspective to the panel today. For those, if you're not familiar with Locus, we're an AMR provider, autonomous mobile robot provider, and we help move items in a warehouse, anything from each case to pallet, and facilitate use cases like picking and put away.
Perfect. Thanks for that, Steve. And last but not least, Mike, if you can introduce yourself and your organization, please, too.
Hi, yes, thanks, Nick. So Mike Packer, I head up our healthcare automation division within UPS Healthcare. UPS Healthcare has been supporting healthcare companies for the last 20 years.
Looks like Mike's internet's gone there. We'll kick things off while he comes back. Steve, just to start off things, can you give us a quick introduction on some of the key challenges that you're currently seeing that are driving innovation in the warehouse space?
Yeah, specifically across all industries or specific to healthcare?
Across all industries and a little bit of healthcare as well.
Yeah, across all industries. Of course, it's hard to ignore the labor issue. Labor is very challenging to find, good labor as well. And they're hard to train and retain. So that's certainly one challenge. Order cycle time, being able to fulfill orders quickly and accurately. That's certainly another challenge that we see today.
Perfect. And now we've got Mike back. Mike, if you can just finish your introduction, and then as you're introducing yourself, can you also explain some of the key challenges that you're seeing that are driving innovation in the warehouse space?
I'll start over. Mike Packer, I'm our automation director for UPS Healthcare. We focus on pharmaceuticals, med device, and labs, biologics. And then really from within our space, key challenges, certainly, maintaining the quality of culture or the culture of quality that we have. Everything that we focus on is really highly regulated, highly complex. And then, with a global footprint, making sure that we're maximizing the quality aspect across all geos and not just one.
Perfect. So Jerry, just bringing yourself in there, Steve and Mike mentioned a lot of key points there. Just from your perspective, adding to what they've mentioned, what are some of the key challenges that you're seeing that are driving innovation in this area?
Yeah, absolutely. The labor situation, an extremely variable market right now and unstable. But when we're looking for technology in Cardinal, we want to make sure that what we research and develop and pilot and implement really sets the tone on a multitude of levels. First and foremost, we want to impact the customer experience. We want to make sure that their experience is stable, is predictable, and that comes with a solid technology mixed with your labor. We also want to improve the employee experience. for their experience to be stable and predictable and safer, and also drive quality and productivity improvements.
Perfect. Wanda, just from your vantage point in the industry, obviously, for different perspectives here on the webinar, can you just explain from your perspective what you're seeing some of the key challenges in the healthcare supply chain specifically that are driving innovation in this warehouse space?
So back to labor, I think everybody's touched on that, but not only with the labor issues, it's also coming to how do we increase the speed of those requirements? So going back from looking at it holistically, it's taking not only the labor shortages, but we have to understand the labor shortages is not going to, you can bring in more people, but you have to actually, how do those people work side by side with the robots? So, not only, and then understanding that piece along with the challenges that come with implementing a new technology. So a lot of people think that, hey, I'm just going to do this really quickly, and I just pick the best one that has all these shiny parts on it. But you need to peel that back and peel the onion back and start looking at what is those, are those meeting your requirements? What's, you're going to have to do an upfront cost, and what's that going to look like in the long term. And, one thing you're going to save on is you're going to save on increasing that speed of your requirements and also the visibility of your inventory.
Perfect. And Jerry, you and I have discussed obviously the just-in-time elements of the healthcare space. Can you just explain a little bit about that, some of the challenges there, and why that's driving innovation in the warehouse space?
Yeah, we really in the medical products business don't have any ability to not deliver to our customer. We are oftentimes delivering surgery packs or any type of hospital good that could potentially be a part of a life-saving procedure. So we also hold inventory for our customers so that they don't have to take up a lot of space in their system. And so we're almost like their storage room, their warehouse. And there's really no excuse to not be able to deliver to our customers at the hospitals, the surgery centers, and the doctor's offices. We really have no room for error. And one other thing I wanted to mention off of Wanda's point in regards to the labor, just circling back to that real quick, for instance, with robots, like with Locus, not only is there, the productivity and being able to step in where labor, there might be a shortage. We've also seen an improvement in the experience of our existing employees where they enjoy that interaction with technology. It drives value to the job they have. And we've actually seen our turnover decrease in sites that we're using robotics and technology.
Perfect.
And can I add, I'm sorry, I want to add something to what he just said, because a lot of times we have to look at the picking piece. And, Lucas can, Steve can bring this up, but with picking, today they're walking. So if you look at the technology that we're bringing into, we have a lot of new people that's walking into the warehouses, working in these warehouses. They're used to these touch screens. They're used to all this new technology, not what it used to be back when I can say when I grew up in the warehouse. So we have to look at, we're saving time with walking, but also we're actually upskilling our workers, as Jerry was talking about, and they're excited about this because we're bringing them along the journey of this process, and that makes a difference.
Perfect. I know that's something that we'll touch a lot on further on in the conversation. Mike, just from your perspective, looking at the unique, I guess, regulatory requirements in the healthcare space, can you just talk about some of the challenges there and why there's such a need for warehouse innovation?
Differences with healthcare compared to other industries is we have CRT space, we have cooler space, which is 2 to 8 Celsius. We have freezers, which are -20 Celsius. You can get ULTs, which are down to -80. There's DEA products, controlled substances. So there's a lot of unique environments within the warehouse that certainly can allow for automation to play a role and to assist. And then you factor in there's multiple regulating bodies In the US, you have the FDA, the DEA, you can get into boards of pharmacies, and then, globally in other countries, regions, you have that equivalent. So a lot of checks and balances for a good reason, but certainly, introducing technology, the validation aspect makes it, a little more challenging, and at the same time, just as rewarding.
Perfect. And Steve, just bringing yourself in here, obviously Locus has a wide customer base across a number of different industries. Can you just talk about some of the unique challenges that you see, just to kind of Mike and Jerry's point earlier, in the healthcare space that are driving interest in, for example, your solution?
Yeah, we've already talked about a couple of them. Certainly one of them is the SLAs that your clients expect. So like Jerry mentioned, there's really no option not to deliver. So being able to fulfill an order, pick, pack, and ship it and get it to the client the next day is absolutely critical. And then Mike mentioned all of the compliance aspects, and the ability to scan everything that you need to at pick to capture things like lot code and serial number, and just validate that you do indeed have the right item. That's another aspect that's not necessarily entirely unique to healthcare, but prevalent across all of healthcare.
Perfect. And following up with yourself there, Steve, can you just explain, for logistics service providers out there that are investing in these kinds of warehouse automation solutions, what's the link between a more efficient warehouse operation and growth for logistics service providers out there?
I'm sorry, could you rephrase, Nick?
In terms of that link between warehouse innovation, improving the efficiency of warehouse operations, and growth for logistics service providers.
Oh, yeah. So it's, as far as growth goes, it's all about doing more with what you have today. So, being able to bring in automation to get more out of the same facility. For a 3PL provider, being able to bring a new client in, having the flexibility to support different product types or different order types. It's all about supporting growth.
Perfect. And then Mike, just from your perspective there, how are you seeing this, specifically talking about, for example, RFPs?
Yeah, I mean, we've seen an increase in our clients, asking what kind of technology do you have? What is your experience with it? Where do you have it deployed as part of RFP responses? So certainly as a whole, the industry is more aware of what's out there. So human nature, we're all interested to know who has experience where and with what technologies. And then kind of to piggyback on what Steve had mentioned, I think for anyone, and Jared, interested in your opinion within healthcare, we look at validation needs to prove that the equipment does operate as designed as expected. There's a huge cost of entry for technology, if you will. So having that scalability of one platform globally certainly aids in, our ability to expand quicker.
Perfect. Go ahead, Jerry.
Yeah, and we need to be flexible. When you look at the speed at which hospital systems acquire and merge, we need to be ready to take on additional volume at a moment's notice. And so the flexibility that the technology gives us is extremely important.
Perfect. Just delve in deeper into that, and Wanda, I'd be really interested to hear your opinion on this. There's a lot of shiny new toys in this warehouse space at the moment. There's a lot of innovation that's kind of entered this area in the last even 2 or 3 years. Just from your perspective, what are some of those key metrics and the key ways of finding the real value in some of these warehouse automation investments?
Yeah, so I mentioned some of these earlier. We want to make sure we're driving towards safety. For an example, with the Locus Origin robots, we have had employees for years pushing carts 300 or 400 pounds throughout their shift, where now the robot delivers the work for them. So a huge safety and ergonomic gain. the productivity piece and the speed and the increase in our process capability, I believe that speaks for itself. From a quality perspective, some of the different images that are able, you know, we're able to pull and share on the different screens that are available in the technology really enable our employees to make the right pick and the right quantity for our customers. And really what we're trying to do is eliminate anything we can look at from a waste perspective as in terms of transportation for our employees. We want to eliminate that waste. We want our employees focused on delivering value-added processes to our customers.
Perfect. Wondered, love to hear your opinion on kind of Jerry's points there.
Jerry hit it right on the. He said, you know, it's safety. I think a lot of times, you know, look at the safety numbers before and after, but also on your productivity, you're picking SLAs, going back to, you know, how many hours does it now that before, I'm just using this as hypothetical, you may have only picked X amount of units before, but now with this, you have this new technology. Now you can push through double or triple time of that amount of product through the warehouse. And what really makes a difference, especially if you start looking in healthcare, is you want to make sure that's the accuracy of your inventory, because now you're actually affecting someone that may be in a hospital or surgeries and all that. So though that accuracy that you can actually now use with that technology will actually help drive better results when it gets to the hospital system, within the hospital.
Perfect. Mike, I'd love to hear your opinion on how you guys see the value equation when it comes to warehouse automation.
Certainly is the health and safety of employees. We do value their feedback. So in an area, whether it's they think, hey, this would be a good fit, or just their experience with the technology is one we look at. We also have the benefit of our global logistics and distribution, which supports all of the non-healthcare customers and product, to where we can, you know, brainstorm with them, because certainly they're in a different space. So their needs, their technologies they look at could be different, but they could be something we can leverage as a greater team.
Perfect. And Steve, I'd love to hear your opinion on kind of how you're seeing this, how you're seeing these companies attribute success, understand that the metrics of improvement as they're implementing some of these solutions.
Yeah, it's you know, the biggest benefit is, of course, operator productivity, and we typically try to double or more improve the productivity levels of operators. And back to the safety, we've received that feedback as well. We're often replacing manual processes where pickers are pushing around carts, very heavy carts, 200-300 pounds or more, and you know, they implement our solution, and now it's hands-free. They have two hands to complete the operation. Back to the quality, we can present an image of what they're picking. The robot stops right at the location that they're supposed to pick from. It all helps improve, you know, ergonomics, accuracy, and speed.
Perfect. And Jerry, did you want to add some points there?
Yeah, I wanted to reiterate and build on something Mike said in regards to talking to the employees. That's really where this journey should start. That should be the strategy, to spend time with your employees and understand what are the jobs and tasks and processes that they have that are difficult, that could be made easier, could be made more efficient. I think you got to start there and then go find your technology, as opposed to looking at the technology first, because then I think you sometimes can get into the implementation of technology for technology's sake and not to address a specific problem. And if you do that, you'll probably lose some credibility with your employees. You want to spend time with them, talk to them, get their opinion, and drive towards how do we make their jobs better so they can then ultimately do a better job of servicing our customers.
Perfect. I mean, you answered it there, but I'd love some extra advice from you. For a lot of companies, they're starting out their journey on this warehouse automation piece. Can you just explain from your perspective some advice that you'd give to companies that are new to this and how they can ensure that there is success as they're implementing these projects?
Yeah, I think, first off, you've got to make sure that you're solid in understanding your value stream and understanding your supply chain and making sure that you're looking at it from end to end. And also key to understand any variation you might have from different sites, different processes, because the more you can keep those processes stable and predictable, the more you're able to go out and find a technology that will be able to scale for your business. And so there might even be some standardization work ahead of technology that you need to do if you really want to get the most benefit from your implementations.
Perfect. And Mike, I'd love to hear your opinion just on Jerry's points there on what advice would you give to companies that are starting out this journey?
The employees, where's their biggest headache every day? What kind of feedback can they provide? Certainly standardization, if you are picking, via a cart as the example, in 5 different warehouses, but they all have a different flavor, then certainly for the success of the implementation, you may need to standardize or see if the technology will standardize for you. I'd say the biggest challenge, particularly being an engineer, is when you start looking at something, you want to solve everything. And just remember, you don't need to solve everything at one time. Take the baby steps, get the first one implemented under your belt, lessons learned. And then from there, you can start scaling and looking at the rest of the value stream.
Perfect. Go on, Jerry.
Yeah, you definitely need to prioritize. And you also need to have some courage to potentially fail. And I know it's not a great word, but you really need to have that courage to try, and drive yourself through that research, business case development, piloting, and what have you. But I sincerely doubt that anybody in this technology space in this day and age is going to bat 1,000. Nobody's going to be perfect. You've got to have that courage to try. But once you go out and try, you need to make sure, to Mike's point, you prioritize what your biggest pain points are and what you want to eliminate in that regard.
Perfect. As a Brit, that baseball analogy almost went over my head, but I think I understood what you were
My
trying
apologies.
to say. No, everyone else would have got it. Wanda, just from your perspective, obviously in your vantage point in the industry, do you have any best practices to add to Mike and Jerry's points there?
It's just early adoption, back to what they're saying is, before you jump in and do that selection and say, hey, I want to pick XYZ technology, is to get the total involvement. Make sure, as Jerry pointed out, it's the processes. Do you have common processes? You have 4 different facilities, but now how do you actually start doing that continuous improvement and looking at what you have today? How do you standardize those processes before you start bringing in technology? And then the biggest thing is, the change impact on your employee. How do you get them early into that conversation? Because if you bring them along that journey, it actually helps a lot instead of you just doing it as a silo. Last time I really want to talk about is, when you start looking at all these technologies, how do you actually do a short list and, understanding these are the key, my key requirements. So you already did your business requirements, your systems requirements, making sure that you have all of those laid out. And now once you do all of that, now how does that really match up to that technology that you want to bring in-house? And back to what Jerry said, I do pilots. The pilot sites are the best thing you can do. Look at the volume that's coming through there, making sure you communicate. So not only when you implement, how do you communicate to all your customers ahead of time? That communication tool is the most important thing, because once you start implementing and then you're going to impact, you want to know that about how do you bring them along and make sure it's not just within the house, but external customers too, and who you're going to be shipping to.
Perfect. That's a lot of great advice. Steve, obviously we've touched on different perspectives here. Just from your vantage point in the industry, what are the best practices that you've seen from the customers that have implemented this very well?
Well, one best practice that I would recommend is really lean on your provider for guidance and advice. For example, Locus, we actually were incubated in a 3PL and we spun out of a 3PL called Quiet Logistics. We have a ton of fulfillment experience across the entire company, and we have a lot to offer. And I don't mean to speak to our clients for our clients, but we've gotten a lot of feedback that we bring a lot of that experience to the table. Chances are, if you have a challenge, we've seen it before and we can help you solve it. So that's one thing. The other is we do spend a lot of time on change management. So, we try to work very closely with the on-site operations team so that they know what to expect when we come in. We involve them in the training. We try to get them excited about the system that's coming in. And there's also benefits for the associates that are actually working with the system. For example, many warehouses are multilingual. And with our solution, our operators actually wear a low energy Bluetooth tag. So when they approach the robot, it automatically knows who they are. It authenticates and identifies who they are. And we can present the user interface in their preferred language. And that's just very comforting to a user.
Perfect. Yeah, I think that language piece is not something that's mentioned enough. So really appreciate you mentioning that there. Mike, just from your perspective, are there any other best practices that you wanted to add to this conversation?
Where in the value stream we touched on or wanted to do with some of the metrics maybe that you could look at, make sure, are included. I'd say really the last one is when you're looking at the actual vendor to help you with that area, there's got to be some level of comfort and trust. Just because they have the coolest technology that fits and solves your problem, if you don't have that comfort, it may not be the best choice to go down just because it's the new shiny object. So I definitely think that has to be there. And I know that's one thing with our relationship with Locus has certainly been there. We've challenged each other and all for the better of both organizations.
Perfect. And something that we've touched on here in this conversation and on previous conversations is the nature of the siloed technologies in the warehouse, and that continues to be a challenge. Jerry, just from your perspective, what can be done to solve this problem?
Yeah, and I'll lead answering that question with when you're looking into suppliers, into integrators, into partners, they must be trusted, as was mentioned before. And I think it's extremely important that they're good listeners and not just hitting the ground running with, we're going to try to fit our technology somewhere. They've got to, there's got to be some trust there and understanding that we're not, again, just trying to do technology for the sake of technology. And then, there has to be an understanding and work on how different systems can talk to each other, how different technologies can talk to each other, because I'm doubtful that today there's one supplier out there that will fit all of your needs. And so I think you've got to look at it from a much bigger picture on integrating not only with your own systems, but systems from different technologies. Absolutely needs to be something that you're looking out forward to and not just being occupied in the here and now, what those next steps might be, what's your strategy, and how everything would connect in the future.
Perfect. Wanda, would love to hear your perspective, just to Jerry's points there on that challenge that we're all seeing when it comes to those siloed technologies.
Back to what he was saying is, you really need to make sure you understand all the technology you have in-house before you start going out and looking at all the technologies that you would like to bring in-house. So, you may have some old antiquated systems that don't talk to each other. So I know from my experience, I've had a lot of different systems, but back to what will give you the expectations of not short-term, but long-term. So one thing that I always talk about is the order management system. You know, a lot of times people don't look at, hey, should I select the order management system? But it actually gives you not only the people in the warehouse, but your customer good visibility. I'm just throwing that one out there. But if you really look at it holistically, how do you want to make sure that your customers can see the information that when their order is done, how do I actually know that my order is leaving that warehouse? And now when I start looking at all these systems, you have so many. Now, how do I connect all of them together? Some of them can be connected, you know, one-on-one, but what do you need to do? And you look at that total landscape.
Perfect. Steve, just from your perspective as Locus, how is your company tackling this siloed technologies challenge? Just to Wanda and Jerry's points there.
Yeah, no single solution can be all things to every warehouse. So I think interoperability is absolutely key. And we keep that in mind. I think we've entered a period of interoperability. We're going to see a lot of that in the industry over the coming years, whether it's standards on how to communicate with other systems or partnerships. And, you know, for example, we've recently announced a partnership with Berkshire Grey for an automated put wall solution. So it's two best-in-class solutions coming together, providing a solution that's, you know, the whole is greater than the sum of the parts, if you will. So.
Definitely highly complementary. Mike, just from your perspective, before we move on, how are you seeing this siloed technologies challenge, and what are you seeing that's being done to improve the situation?
A niche, you know, technology that's looking at solving just one challenge. I certainly agree with Steve and foresee software, whether it's just standard approaches or kind of a middle layer that just helps bridge the communications between everything. Maybe a more advanced WES type system that's off the shelf. And then certainly I foresee strategic partnerships in the future, as Steve mentioned, between them and Berkshire Grey being a huge stepping stone and probably the direction the industry is going.
Perfect. One of the other major challenges that we're seeing is working with some partners that may be not as technology savvy as, say, a Cardinal Health. Jerry, just from your perspective, how are you looking at that challenge?
Yeah, well, I think I would hope that our customers, other suppliers that we work with, would look to us for some leadership there and some sharing, especially when you get into the world of hospital systems that might be involved in self-distribution. So we don't deliver directly to their hospital doc, we go to their warehouse. And we've had the opportunity to share a lot of our findings with customers that are in that self-distribution space and help them along. And then along that way, we can learn from them as well. It's really a sharing, a give and take.
Perfect. Wanda, would just love to hear your opinion on that challenge where you have different partners maybe along the supply chain that are not as technology advanced as, say, other companies like a Cardinal Health.
And it goes back to, we just have to, as far as advancing technologies, you have to listen to the customer. You know, that's bottom line. You know, you can have all these technologies and all these things out there, but if you never listen and sit down and hear back to what Gary's point is, what the customers actually, their pain points and what they need, how do we actually select that technology to be the fit for them? And then in healthcare systems, it's a lot that, you know, you're impacting. It's not where you're shipping a shirt. You're impacting a patient, you're impacting someone that's their life. So how do you take that and understand, you know, when you go through that process, you are, you're going to make someone's life better. So that's how, you know, we look at it, and I look at it is, you know, that technology makes a difference, and you want to make sure you get the right one for the right, at the right time, and implement it at the right time.
Definitely. Obviously, we're talking here about automation, but Steve, you mentioned before the importance of the warehouse workers. You mentioned the language solution that you guys have. Can you start off with Steve? Can you just explain what role you see people playing in this warehouse operation space as automation advances?
Yeah, people are still at the core of our solution. People are very good at obtaining items of different form factors, different sizes and weights, and determining that they have the right one. The automation world hasn't completely figured that out. So keeping the person, as part of the solution is very core to what we do. Also, the information that we're able to provide, it's not just a robotic solution, but we're providing information that help companies manage their business. So, Wanda mentioned earlier about inventory. We're always updating the WMS when an item is picked. It, automatically shares that with the WMS so they know exactly what they have and where it is. And being able to manage your organization, even if it's multi-node, multi-site, being able to look at a dashboard and have visibility to that just helps people manage people.
Perfect. Jerry, I'd love to hear your perspective on how you see the people playing in this warehouse operation space.
Yeah, it's a big deal. And we want to invest in technology that unlocks more potential out of the employee. We want the employee and the technology to be able to work together as partners, but then also through different parts of the process, they have to be able to work independently. We're not interested in technology that needs, for lack of a better term, supervision of the technology at all times. It needs to be delivering a part of that process that now our employees don't have to worry about. They can focus on something else, but then when the time's appropriate, they work together as a team.
Perfect. Mike, would just love to hear your perspective on that, just to Jerry's point there.
Covered everything. The employees are the key for really any technology. It's just looking at how they work together, where in the value stream each one is shining, if you will, and then allowing the employees to focus on the complex task, tasks that are what humans are good at.
Perfect. As we wrap up with the last couple of questions here, Wanda, would love to hear your perspective on the change management piece. Obviously, this is a very dynamic, fast-moving environment that we're all living in, especially in the warehouse automation space. Do you have any piece of advice for leaders that are looking to implement some of these projects, specifically on the change management side of things?
Yes, back to when I talked about early adoption and making sure you have that communication plan, because a lot of times people think of change management as training. It's not only the training piece, it's actually how do you educate and get them involved as they go along the journey. So change management is the impact analysis of, now I'm introducing this robotics, or I'm introducing a cobot, or whatever it may be. How do they actually will be involved in that testing of that, understanding how that works, all that makes a difference. And then additionally with change management, it's, not only once we go live, but what happens after we go live. And how do we actually continue to have that impact on the employee, where they actually start giving you feedback. As I think Jerry talked about it, lessons learned. A lot of times we think change management, everything ends once we go live. Now, let's get those employees who's actually out there doing that work, because you're going to actually do some upgrades and some changes, get them involved in what did I see that may need to be changed or improved, and get them involved in that conversation. Then you will see a better, and then those people are now going to be training your other people in your other DCs. And then you can get them to be along the journey and understand how well and how better that technology is actually going to benefit them.
Definitely. Jerry, earlier you mentioned that the word of that F word of fail, right? Can you just explain, just from your perspective, just to Wanda's points there as well, around that change management piece and how we can make sure that these technologies are actually implemented in an effective way?
Yeah, and I think, as I had mentioned before, when you spend time with the employees, understanding their challenges and their pain points, that right there, I think, is the beginning of change management before you've even tried anything, because they understand we're going to head somewhere different and their input is valuable. So yeah, absolutely. I think that's got to be a key element of your change management, is helping them understand why and prioritizing those whys. And, you know, again, you know, you even outside of technology, you change different processes, you run Kaizen events or what have you, and maybe something doesn't work as you thought it had potential. But, you know, as a part of leadership, I think you've got to encourage the courage, so to speak. But again, you know, I think Wanda did a great job of talking through that change management, but you know, change management really starts at the very beginning and getting those employees invested in what are we going to go after? What challenges are we going to try to take down and hurdles we're going to cross?
Perfect. There's a lot of good quotables on that one, so appreciate that, Jerry. Steve, would love to hear your perspective on this change management issue.
Yeah, so our clients influence our product roadmap. We're always soliciting for ideas from our clients, and we evaluate everyone on, you know, effort versus impact. And we try to get we can't promise everything to everybody, but we try to get features into the solution that are impactful. So that's, you know, that's certainly one way.
Perfect. And before I ask the last question, Mike, I'd love to hear your perspective on this change management issue to everyone's points here.
Buy-in, if you will, the education, their feedback, and then also, you know, from other leadership. You know, it's a two-way communication internally, and then obviously it's two-way communication externally when you're working with your provider. So, you know, it's all about the communication one way or another.
Definitely. So then as we wrap up today's webinar, I'll ask each of the panelists to explain what excites them about the future of warehouse operations, maybe starting off with Wanda with that one.
Well, I'm gonna tell you what excites me, because I was in a warehouse back in the day when we did all manual picking, and when we just started out with some low light technology. But what excites me is how we get the client, because coming from Deloitte Consulting, you know, we really do systems integration work. So how do we actually start that journey with the client, getting them to understand that impact? And for me, it's looking at the robot who's now doing electronic put wall, where beforehand we did all that manual picking, and then we're saving that employee from safety issues. Those things like that makes me excited, because now I'm making our the person that's in that warehouse that's doing it day in and day out, making their job easier, and also upskilling them to be more of that technology savvy and all of that, not just them just doing as we say, sometimes a mundane job that they're just picking, but now they have all this integration, new technology that they are actually helping us along that journey.
Perfect. Appreciate that, Wanda. Steve, I'd love to hear your perspective on what excites you about the future of warehouse operations.
Yeah, the sky's the limit. I think we've only scratched the surface on, you know, use cases that can be accomplished with automation. You know, just take Locus, for example. We've recently introduced different robot size form factors. So now we can support what I'll call medium and large size products all the way up to a pallet. But use cases, we were talking earlier about unloading trucks and doing that autonomously. So just, you know, further penetration into fully automating a warehouse.
Perfect. And Mike, we'd love to hear your perspective. What excites you about the future of warehouse operations?
Developing. And then within UPS Healthcare, we have our motto is quality focused, patient driven. And I think working with, you know, Locus, we're able to really demonstrate that between our partnership, just looking at they want our feedback. Like, hey, where do you need help? Where do you need to go? And through that, you know, discussion, we now have their Origin robot operating in coolers. I mean, they drive in and out. So certainly the partnership between, you know, the company and the technology provider, I see in being huge. And there's a lot more of that openness from what I've seen in the past.
Appreciate that, Mike. And last but not least, Jerry, I'd love to hear your perspective on what excites you about this space.
I'm excited about technology being able to support Cardinal Health, taking service to the next level for our customers. And not only our customers, but the patients that we serve. You know, those patients are all of us. They're our family, they're our friends. And so that's really exciting to be a part of a time where technology and innovation is going to increase our ability to service those customers, service those patients, which are us, you know, all of us and people that we care for.
Perfect. That's a great place to end. Given the dynamism of the space, I think we need to get everyone back for a part 2 in 18 months' time, and I'm sure things will have changed a lot. My thanks to all the panelists today for taking the time out of their busy schedules, and I hope to see everyone on another webinar very, very soon.